Picis empowers hospitals with solutions that help improve quality across the most risk and cost-intensive care areas: the emergency department, perioperative care areas, and the critical care unit.
Our hospital system saw a return on investment in the first 2 years of a little over $6 million.
Since we've deployed ED Pulse Check, we've seen a gross revenue increase of $600,000 and a staff labor decrease of $225,000. And that was just over the past year, actually.
Our professional billing has been greatly enhanced using that product. Just the legality of completeness of record, legibility of record, continuum of record.
The main thing we wanted to do was to have better access to our patient data, to improve the processes of care. We were also looking to be able to actualize a return on our investment in implementing software.
The changes our hospital was trying to address when we implemented Picis was to give the nurses a tool that would reduce their actual workload so that they would have the time to do the patient care that they want to do.
The quality improvements that we have seen with the use of ED Pulse Check, I think, primarily focus around productivity, and the use of that tool allowed us to provide feedback directly to the providers, to our nursing staff and physicians, about the number of patients that they were seeing, the criticality of the patients that they were seeing.
The systems that we put in place should help us decrease the amount of time we need to spend charting and increase the amount of time we actually spend doing the thing we went into medicine for, which is caring for patients at the bedside.
We went live with 100% participation. Within about 2 months, almost to the last person, everyone there said that they just could not imagine going back to a paper system. That this is how they want to do business. This allows them to manage a busier department than what they could manage on paper and track with a plexiglass magic marker system.
With Picis, because clinicians have easy access to patient data, they can spend more time delivering care.
We would have accurate information available to the clinicians and the entire team immediately and make sure that it's accurate. So it has been a win-win for all the clinicians in critical care.
They feel that they got more of my time, and I think that's a great patient satisfier.
No other high acuity product suite comes close to matching Picis's performance.
We had made a decision to implement systems in our high acuity areas and was searching the marketplace. Picis really had leading edge solutions for us in terms of perioperative, in critical care, in ED.
We can provide patients with that connectivity of the physicians talking to each other. So when you have a patient that shows up to a cardiologist's office and the cardiologist wants to make a change in the medications, he's aware of what's going on with that patient by the other caregivers and not making a significant mistake on medications.
It's having a product that is integrated with data exchange across all spectrums of the patient's care, including ED, inpatient, outpatient, OR, inpatient, outpatient, patients that go from the floor to the ICU.
In our facility, the integration that we've been able to achieve with the other ancillary departments has allowed us to be recognized by the steering committee for IT as the only complete electronic medical record in our facility.
Picis supports compliance across the most risk and cost-intensive areas of your hospital.
It also provided us Joint Commission standards. It was much easier to implement standards and then hold people accountable to them. So improving accountability across the board was a primary quality improvement that we saw.
What I would share with other customers is I think the system is very user-friendly. I like that the system talks to the different modules.
The reasons that we chose the Picis solution was that it provided us a fully integrated system from the preoperative areas through the holding room, through the ORs, along with the anesthesia department, and through the PACU phase of care. We felt that that offered us a fully and complete opportunity to document the care electronically and provide us information through the entire process of care.
Picis is partnering with hospitals around the globe to overcome the biggest healthcare challenges they're facing today. These partnerships help deliver immediate, measurable results in both quality of care and financial performance.